It took Beijing less than a month to quash the second outbreak of COVID-19, which came from Xinfadi Market. The key to successful prevention and control is to track down the infected people with epidemiological investigations and put them into quarantine before they show symptoms and come to the hospital of their own volition. After the first confirmed case was found on June 11th, it was determined within 16 hours that the origin of the outbreak was Xinfadi Market. How did Beijing track and find the COVID-19 cases so quickly?
流调实际上它主要的目的就是两部分，一个是找到它是从哪儿感染来的，这样去追踪一下这个可能的感染来源；还有一个呢，就是及时找到密切接触者，进行这个控制，然后减少向外扩散的这种可能性。流调一般来说都会在报告以后24小时内要完成。你越早的把这些密切接触者调查出来，那么你就可以越早的控制疫情，减少向外扩散的这种风险。
Epidemic surveillance was the first thing we did as part of the investigation. After the cases were examined, confirmed, and recorded, the statistics were handed to Liu's team for epidemiological investigation. The team sorted out the information of the close contacts and then gave it to the close contacts team for further investigation. Generally speaking, part of the investigation was carried out in the hospitals and part in the patients' homes. According to the law of the People's Republic of China on the prevention and treatment of infectious diseases, residents need to report their personal health conditions, contact history with patients, and travel history faithfully. Put simply, the purpose of an epidemiological investigation is to find out who infected the patient and who the patient infected, digging out the chain of infection. Suspected cases, confirmed cases, asymptomatic infections, and clustered cases are all targets of our investigation. Disease control staff will make contact with the patient, their families, the treating doctor, and other relevant individuals through observation, inquiries, and looking up information. They will help the patient to recall their itinerary over the 14 days before the onset of the disease and find clues to the source of infection. In addition, in order to prevent the disease from further spreading, it is necessary to locate close contacts and protect them. If a patient is put at the center of the circle of infection, close contacts and general contacts are the focus of our attention. The key measures of infection prevention and control are to find the contacts and isolate them to cut the infection chain. To define an individual as a close contact, we must look into the time, method, and environment of contact. Starting from 4 days before the onset of symptoms, people who came within 1 meter without medical protection are considered as close contacts.
患者他要回忆他发病前14天的这个行程轨迹，那么他有可能出现叫做回忆偏移，或者是说他遗忘的，或者是有可能出于某种原因他隐瞒的这种内容。还有一种方式呢，就是我们会通过公安的这种大数据来获取他的这个行程轨迹，可能是通过一些手机信号啊，包括他的一些身份信息啊，来核实这14天的这些相关的数据。
According to the prevention and control requirements of COVID-19, close contacts need to be isolated for medical observation. Xinfadi Market, where the outbreak first occurred, is a huge and crowded place, covering over 160 acres. So, to prevent further spreading of the virus, Beijing carried out its most strict epidemiological investigation to date. In addition to the traditional epidemiological investigation methods, some emerging technology was also put into use. For example, Bluetooth backtracking technology was used to locate close contacts. If someone in the building was diagnosed with COVID-19 and the patient had a Bluetooth device turned on while in the building, the wireless sensing device in the building was able to quickly find close contacts who had been within 2 meters of the infected person. Such technology has been applied inside buildings in Zhongguancun, Beijing since April. With the help of big data technology from the Ministry of Industry and Information Technology, the Ministry of Public Security, and the Ministry of Transport. A more detailed epidemiological investigation has been carried out to make sure all close contacts can be found and isolated as soon as possible.